Hello everyone, a very good evening to all. I am Dr. Vinay Purohit, a pharmaceutical physician from Lupin Limited. And on behalf of our entire Lupin team, I would like to welcome you all to today's session for our Say Yes to Life initiative. Say Yes to Life is an initiative aimed to offer hope to every person suffering from a mental illness. This initiative not only builds awareness towards mental illnesses, but also helps in reducing the stigma of talking about mental health. With this background, I would now like to introduce the President of India Region Formulations of Lupin Limited, Mr. Rajiv Sibal. Mr. Sibal will help us understand the thought process behind this initiative much more in detail. A very warm welcome to you, sir. Over to you.
Thanks, Vinay. Good evening, respected doctors. I hope you all had a great and safe Diwali. I'm sure you and your loved ones are vaccinated and taking all the necessary precautions against COVID-19. I would like to thank each one of you for treating and taking care of your patients and supporting the country in its fight against the pandemic. Talking about today's grand event, it is said that mental illness is nothing to be ashamed of, but stigma and bias shame us all. Say Yes to Life is one such innovative initiative by Lupin, which strives to create awareness and reduce stigma and discrimination against mental illness. The thought process behind this initiative is to encourage people to seek treatment against mental illness and stop worrying around the stigma associated with it. We all know early consultations and treatment will help drive better patient outcomes, as some of the conditions may worsen over time. We believe that mental health needs more awareness, more candor, and a transparent conversation with the medical practitioners. And so having an open conversation is an important aspect of Say Yes to Life campaign. To help us in this initiative, we have onboarded some distinguished panel members, and it is my pleasure to share this virtual platform with them. A very warm welcome to Dr. Gautam Saha, Dr. Sunil Mittal, Dr. Avinash D'Souza, and Dr. Arun Nair to grace us with their presence. We also have among us an extremely versatile playback singer, Shaan, who has recreated his song Tanha Dil just to increase the awareness about mental health problems. We all look forward to this great evening where we support to the cause of mental health. I would now like to hand over the session to our moderator, Dr. Vinay Purohit, who will introduce our speakers and take the program forward. Over to you, Vinay.
Thank you, Mr. Sibal. So today's discussion will feature India's foremost psychiatrists sharing their perspectives on the forces that help shape the mental health narrative. So I'm delighted to welcome our featured members for this panel discussion. Of course, Dr. Gautam Saha, Dr. Sunil Mittal, Dr. Avinash D'Souza, Dr. Arun Nair, and the renowned playback singer and actor Shaan. Although none of the panel members need an introduction, let me take this opportunity to introduce them to you all. So Dr. Gautam Saha is joining us from Kolkata. He is the person who really does not need any introduction. He is the humble psychiatrist of the country and whose life is dedicated to improving his patients' lives and increasing awareness on mental health in the society. I'm sure all the psychiatrists in the country know him. He is the president of Indian Psychiatrist Society. So the topic for today's discussion is digital therapeutics, pills and music. And before we begin, let us have opening remarks from Dr. Gautam Saha, along with introduction of other guests. Over to you, sir.
Thank you, Dr. Vinay. It's really great privilege to be here today because along with the all galaxies. In fact, I must thank to Lupin for organizing such an excellent program. They are always, and I welcome Mr. Shaan for this program because ultimately he enriches the mental health and our fraternity. Thank you, Mr. Shaan, for being with us today. At the initially, I'm telling you that you know that mental health, we know everything, everybody, that it is an illness. But we consider it is a disorder. We never tell depressive illness rather than we tell disorder. Somebody shows his low mood does not mean that he is suffering from depression. There are some diagnostic criteria. There are some whether how long it is preserved. Mainly 3 points is very important. Number one, if it hampers his occupational life, as if we as a doctor, Mr. Shaan is a singer, somebody is a teacher, if it hampers his occupational life, definitely he or she needs treatment because he is really suffering from disorder. Number two, if these symptoms really creates problem in some interpersonal relationship like his wife or like his friends or like his colleagues, then definitely he or she needs treatment. She is suffering from mental illness or mental disorder. Number three is if he or she is harmful to himself or herself or to the people around surrounding him, is definitely needs treatment. These 3 points is very important. But you know, the treatment gap of India in psychiatric illness is almost 85%, 75 to 85%. That means only 15 to 20% of the people reach to the proper treatment. Because of the main factor is stigma. This stigma causes hinders to reach them to the proper place for the access of the treatment. So it is very important. And if you see, considering this, it is also very important for today's program. And I must thank again to Mr. Shaan for being with us, because sometimes there are evidence-based studies showed that when this anti-stigma awareness program is done through our celebrities, it will be more effective. And as usual, today's topic of discussion is digital therapeutics, pills and music. While pills or drug remain the mainstay of the treatment for many patients, the mental illness and digital therapeutics have a good popularity recently. And digital therapeutics are evidence-based behavioral treatment and have demonstrated their ability to prevent and manage the disease or disorder. And digital therapeutics is a new category that refers supportive care. Basically, it will be the supportive care during the treatment and delivered directly to the patient via software or apps. The scope of digital therapeutics encompasses the treatment, management, and also the prevention of the broad spectrum diseases and the disorders, and are particularly useful in the arena of mental health. So my dear friends, I'm not taking long time because the esteemed panelists like Dr. Sunil Mittal, Dr. Arun Nair, and Dr. Obines D'Souza, they will speak on it. They are one of the best personalities in Indian Psychiatric Society. I'm very happy. And the Indian Psychiatric Society have against stigma, have a subcommittee, and we are going to do in the second week of some public awareness program in the second week of December. So I'm really thankful to the Lupin for organizing this program. And again, Mr. Shaan, I'm really proud of you that you are dedicated for some and sparing some times with us. Thank you so much.
Thank you, sir. So before we get into discussion on digital therapeutics, I would request Dr. Mittal, as he is the Vice President of Constituency Development, World Federation for Mental Health. He is the right person to share the current updates on global burden and challenges with respect to mental illnesses, focusing on depression and anxiety. He is joining us from Delhi. He is Senior Consultant Psychiatrist and Psychotherapist, Director of Asia Pacific World Federation for Mental Health, Founder and Director of Cosmos Institute of Mental Health and Behavioral Sciences. So over to you, sir.
Thank you, Dr. Purohit. It's a pleasure being here on this esteemed panel and this program. Say Yes to Life, and Lupin is doing wonders spreading awareness, because that remains one of the, like Dr. Gautam Saha said, that remains the foundation on which everything can be built, awareness and removing stigma. And thank you for having a popular singer actor on board, Shaan, because as Gautam said, that when celebrities speak, people listen. And when celebrities make music, people listen more, and it touches the heart, and it goes right through. And that's what we require for mental health. See, I represent also the World Federation for Mental Health, the Vice President for Constitution. Theme, which was this World Mental Health Day 1 month ago, on the 10th of October, the theme for the whole year is mental health in an unequal world. Together we can make a difference. That's the byline. It's an unequal world. The pandemic has proven that. It's an unequal world because we know that poverty remains the most devastating force. And the question of equity in mental health is something which Indian Psychiatric Society is addressing. As well as this, that we require each one on board to make a difference as far as mental health is concerned. And I say this with a conviction, and figures which I'll give you will speak. You know, if you look at the whole world, mental health and addictive disorders affect 1 billion people. 1 billion people. That is a large number. Almost the size of India's population across the world is affected by mental and addictive disorders. That's a huge number. And if you look at, you know, we talk in terms of disability adjusted life years, that how many life years are lost in disability. So of all the global burden of diseases, between 7 to 10%, 7% is an estimate some years ago, is the disability life adjusted years. So that means people lose that much of, you know, their life. Saha pointed out relationships, their work and their academics. If you look at GDP figures, it makes economic sense to invest in mental health because this is a very old study, 20 years ago, and current studies we can extrapolate. Anywhere between 15 to 20% of GDP is lost. 15 to 20% of GDP across the globe is lost due to mental and addictive disorders. So that's why it affects performance. Globally, if you look at it, let's look at the global context, and then we'll come to India, and then we'll come to what we are all here about and what digital apps can do and digital therapeutics can do. Let's focus on depression and anxiety. So if globally 1 billion people are affected, the Indian studies show, the National Mental Health Survey a few years ago brought up a figure of about close to 14% people requiring mental health, you know, help. They had some mental health, 14% of Indians. A 2017 publication in the Lancet revealed, it is a study, is a meta-analysis, a lot of data, that close to 20 crore Indians in 2017 had mental disorders. 20 crores, common mental disorders and severe mental disorders, everything included. 20 crores is a large number, with 7,000 psychiatrists in the country, or say 8,000 psychiatrists in the country. And that's why the mental health gap, more than 85% or more, which Dr. Saha referred to. And if you look at depression and anxiety, the figures for depression are about 5%, 4.5 to 5%, which means close to 5 to 6 crore Indians today suffer from depression. And if you look at anxiety, it's about 3%, the most conservative estimates. I would feel this figure is off the mark because clinicians all we agree that it's higher. It's maybe 5 to 7%. But at 3%, it comes to about 4 million, 4 crore Indians, 40 million, 4 crore Indians. In our study, one of the studies we did in Delhi, this was 2016, we did it in 4 universities in Delhi, a database of about 4,000 plus students. And 63% students reported symptoms of anxiety, depression, or other psychiatric disorders, 63%. That's a large, large number. So the burden is huge. People are not aware, people don't know. And a very recent figure, this is now from Lancet, published in 2021, 8th of October, just 1 month ago, that what has happened, what figure have changed during the pandemic. It says the most conservative estimate is almost 53 million people with anxiety have been added to the figures. To the world figures, more than 53 million people have been added who are suffering from anxiety caused because of the pandemic. And 76 million people with So the pandemic has taken its toll on mental health. 2017, we had the World Federation for Mental Health World Congress we hosted in Delhi. I was the organizing chair, and we had this Congress in Delhi. The President of India, Honorable Shri Kovind ji, came for the inauguration. And he said in 2017 that in India, we are sitting on a mental health epidemic. There is something needs to be done. His office tweeted this. And in the last 5-7 years, we have seen mental health get a boost, much more so because not just professionals are speaking, it's everybody's business. Everybody is speaking about it. More so celebrities are speaking about it. And that's what makes a connect. Yet challenges remain. Like I said, the poorest, the people who live on the margin, people who live in in the rural areas. In 2019, we did a survey from our association. We did this survey which covered 27 million people it reached through a newspaper, 14,000 respondents, and close to 80% said, 76-77% said that they had difficulty in accessing mental health services. Even if they were aware, they could overcome the stigma, they could access. So the barriers to care traditionally have remained. First is awareness, lack of awareness. The more we speak, the more people become aware, and the more we talk, the next thing is stigma. The stigma reduces. It is a normal conversation we must have, like we are having today. People can suffer, people come out of it. People with mental health problems are not crazy. They don't suffer from illnesses. They are not. And also, what is important is that not just that they are not mad, they are people like you and me. They are human. Their only fact is, well, illness will come and go. It's like any other illness, depression and anxiety especially. Severe mental disorders may require a lifetime of treatment, like bipolar disorder or schizophrenia, but people can get back to functional lives. So first is awareness, challenge. Second is stigma. So even if I'm aware I have an illness, how do I overcome the stigma to seek help? And the third is, where are the services? Where are the services? So service development becomes an important issue. And even if the service is there in my, say, 100 kilometers from my home, how do I access it? How do I reach there? People living in remote areas, in villages, how do they reach? And then the last thing, affordability. Can I afford those services? So the government has a national mental health program, the district mental health program, having a psychiatrist in every district, commendable work. But we have a long way to go. So what we require is focus on, one, having a new mental health policy, which all of us must speak about. The policy which was declared in 2014, some of us were part of that process. It requires a revision. The Mental Health Care Act, which came in 2017, enacted, is a very progressive, it's an act protecting human rights of mentally ill because they are abused very often. And so that also requires certain, strengthening. Funding has to be available, whether it's from corporate sector, from CSR funds, or the government funds. So what we require is the funding, which is important, and also public mental health leadership, vision. So that vision is required. Mental health is requires to be made a part of primary, medical services, primary healthcare services, and so on. So there's a whole list of challenges. And I go back to what Rashtrapati Shri Kovind had to say, that all of us need to do, we all are aware what are the shortcomings, where we are missing. But then if you put our heads together, we can overcome this challenge also. And music is a big connect. Self-help is one form. When one is at mental unease, when one is at mental, not feeling well, music is something which cheers us up. There is a Cochrane review for people, psychiatrists who would know. This is a 2007 Cochrane review of music therapy. And so it compared treatment as usual and treatment as usual, medicine, pills, psychotherapy, yes, with and add-on music therapy. And they found that in the short time period, addition of music and therapy helped bring faster and better recovery. Long-term outcomes were the same because antidepressants and therapy and lifestyle changes, etc., take a place. They take time. Yet it hastened recovery. And who doesn't know that you listen to a good song, your favorite piece, you feel nice, you connect. And then, of course, in our own Indian tradition, you have music for different seasons. You have ragas for different season. You have rags for different time of the, day, and you have rags for different moods. All the navaras, you have different rag. And popular music was found to be the most effective. So Shaan there, his songs, have seen many of us, including me, through difficult times, listening to his voice. The voice conveys, in his voice, there is a lot of, if I can say, his voice is a smiling voice. It conveys a lot of joy. And then it brings joy to the person who listens to. So over to you, Vinay, for further.
Thanks, Dr. Mittal. So we also have among us an expert from Mumbai, Dr. Avinash D'Souza, who is joining us from Mumbai only. He's a consultant psychiatrist and psychotherapist and research associate of the Department of Psychiatry, Lokmanya Tilak Municipal Medical College, Mumbai. And also he is the chief editor for Indian Journal of Mental Health and founder trustee for D'Souza Foundation. So I have a question for him. Dr. Avinash, do you also agree with Dr. Mittal that burden of mental health illness is increasing day by day? And what are the commonest challenges you deal with while managing this problem?
Well, I think there's no doubt that the burden has increased, and there's no doubt that COVID has, brought mental health into the spotlight, because and I think one of the major challenges earlier was people to access care. And I think a huge shift that we've seen now is with the availability of digital mental health care. So we are seeing so much of telepsychiatry, online sessions, video consultations, so many things happening that I think a huge amount of inroads have opened up. We've had patients from tier 2 cities and rural areas contact psychiatrists in urban areas and seek help. And the patient who was afraid or anxious or worried to go out of his house can do it from the very comfort of his house. So I think that's one very important advantage that we have received. Also, yes, I mean, we definitely, need more psychiatrists. We need more mental health professionals. There is no doubt. I mean, we have a huge population. WHO says that, 1 in 3 people are depressed. So I always say, I say it in a lighter vein, but it's serious that if you, look to your left, look to your right, if both of them are fine, then it's you. It's that common. It's 1 in 3 are, depressed. And they're saying it'll probably go up to 1 in 2 in the years to come. So probably 50% of the world will have some amount of depression. So that means we probably need that many number of mental health professionals. So I think the biggest challenge we have is, according to me in my work, the biggest challenge is to make mental health and psychiatry a household name, which I think we haven't been able to do. People would rave about going to a cardiologist or rave about going to a surgeon or rave about going to a surgery, but no one would ever rave about going to a psychiatrist. They would very often hide the fact that they're going to a psychiatrist. So mental health is not a household name, sadly. That's the only thing. Whereas cardiology, nephrology, all the other branches are, even a brain surgery is highlighted, but mental health is not a household name. There's still a lot of stigma. To give you a very simple example, a very educated person who stays in my neighboring building, wanted to consult me somewhere else, but not in my clinic, which is in his neighboring building, just because he thought people in the area would know he's coming to me. So that is the amount of stigma amongst the educated, let alone the non-educated. So we need to create awareness at all areas. We're doing it at some areas, but we need to do it, all over. In Bombay, like I always say, people who know Bombay well, I say we have to go from Dharavi to Kaf Parade, everywhere. We have to create awareness everywhere. Yeah. Thank you.
Yeah. So thanks, sir. So with this background, I would now like to pose the panel members with some questions on the challenges with respect to the treatment of depression and anxiety in India. So my next question is for Dr. Arun Nair. So Dr. Arun Nair is joining us from Thiruvananthapuram. He's Associate Professor of Psychiatry in Medical College, Thiruvananthapuram, and he's the author of 18 books, including the books like Live, Learn, Look Bright, and Advances in Psychiatry and Medicine. He has also conducted over 2,000 episodes of health and social awareness programs in various television channels. So welcome again, sir. So most individuals who are treated for depression get better. This is usually the outcome with evidence-based treatments like cognitive behavior therapy, interpersonal psychotherapy, problem-solving therapy, and pharmacotherapy or the drug treatment. Nevertheless, most of these individuals will relapse back into another episode of depression within a few years of completing their treatment. And this represents a serious problem with enormous adverse consequences for depressed persons, their families, as well as society. So my question to you, sir, is what ways do you use to ensure prevention of relapses in your patients with MDD?
Thank you very much for that extremely pertinent question, Dr. Rohit. It's very true that there is a tendency to relapse in all kinds of depression. Whatever be the treatment strategy we use, whether it is medicines or psychotherapy, and it is equally prevalent in all sections of the society, be it the highest socioeconomic class or even the lower socioeconomic strata. So we have got the National Crime Records Bureau statistics which were released recently, which showed that 11,396 children less than 18 years of age have killed themselves in the year 2020, which represents an 18% hike in the total number of children who have committed suicide in the previous year. And I would like to remember the famous statement from WHO that the commonest, widely prevalent, easily preventable cause of suicide worldwide is depression. Untreated depression can lead to suicides. By treating depression can not only help the person gain functional recovery, but can also prevent suicides. So that is probably the biggest risk or the biggest challenge associated with depression. In India, as it was very rightly pointed out by Dr. Sunil Mittal, 57 million people are experiencing depression at a given point of time. Right now, we can say that around 6 crores of Indians are suffering from depression. And it is true that even if we give them the state-of-the-art treatment, it's a very high probability that they may relapse again in future. The biggest problem with depression is that depression does not fit into the concept of mental illness, which most of the general public is having in our country, because mental illness is equated to a stage in which a person is violent, disruptive, and producing nuisance to the society. But in depression, we know the person becomes silent, is withdrawn. He doesn't fight with others. He doesn't go out. He doesn't create any kind of nuisance. He is self-contained. That is the problem with depression. So many people don't realize that this is a disorder necessitating treatment. They think that it is laziness which is preventing a person from going to job. So we know that by using proper therapeutic strategies, we can reduce the chance of relapse in depression to as high as 75% over years and years of follow-up. So what I generally do to my patients is that I recommend a follow-up period of at least 1 year when a person comes to me with the first episode of depression, 9 to 12 months of regular treatment with medicines. I also add psychotherapeutic strategies once the person is stabilized enough to cooperate for psychotherapy. I use cognitive behavior therapy, acceptance and commitment therapy, and mindfulness-based cognitive therapy. These are 3 strategies which I very commonly use depending upon the psychological nature of the person. So if we insist on regular follow-up, absolutely good compliance with medications, and compliance with psychotherapy, we have seen that we can reduce the rate of relapse significantly. And again, if the number of depressive episodes is more than 1, we may have to prolong the duration of pharmacotherapy. If a person has had 3 or more episodes of depression in the past, we may have to keep him on indefinite pharmacotherapy, at least for an extended period of time, to see whether he is doing well. And again, 5 to 10% of patients who are maintained on antidepressants, they may relapse every year. A lot of hypotheses are speculated behind that. Is it tachyphylaxis, poop-out phenomena? But the most common phenomena which I find, which is the reason for relapse, is poor compliance. Because after 1 or 2 months of treatment, most of the people, especially in the uneducated sector or rural India, they may think that the symptoms are conspicuous by its absence. What is the need to continue the medication? Will continuing medication damage the liver or kidney or produce serious health consequences? That is an important concern. So we may have to explain to the person regarding the common adverse effects. And we also explain that the adverse effects of the antidepressants are probably much less than the adverse effects of medicines, which are commonly prescribed for diabetes and hypertension, etc. But still, there is this stigma and there is this misconception. So what I feel is that rather than any kind of poop-out phenomena, it is lack of compliance, which is leading to relapse. And the supporting therapeutic strategies, which include regular exercise, a proper diet, proper sleep-wake cycle, and most important, listening to good music. They are great things which can prevent relapse in the future. Thank you.
Yeah, absolutely true, sir. In fact, that was my next question for Dr. Mittal as well. Studies conducted in primary care as well as in psychiatric settings show that more than half of the patients suffering from major depression have poor adherence to antidepressants. So what in your experience, Dr. Mittal, are the reasons for poor adherence, and what measures can we take to improve this adherence to antidepressants?
Right. Thank you, Dr. Vinay, for that question. I think Dr. Nair has already laid the, given a part of the answer. Yes. See, in treating any patient with depression, it's a partnership. In any treatment in medicine today, it's a partnership between the service provider, that's a mental health care, the doctor, the psychiatrist, or even if it's a psychologist, psychotherapist, and the patient and the patient's caregivers, family who are concerned and who are, there, or if sometimes even family is not there. So adherence has two components then. One is the patient, and the second is the doctor. So some are patient-specific, factors, and some are doctor-specific factors. And if we also look at adherence, then one is that the patient fails to persist in taking the medication for the desired period of time. And the second is the patient takes the medication, but the patient is very intelligent and doesn't take the right dose, doesn't follow all the instructions. We know this, that if you ask a patient, are you taking the medication? Yes, I'm taking the medication. And then when you ask them what dose, then they have already modified the dose to suit their requirement. There may be multiple reasons: medicine side effects, poor understanding, or somebody telling them don't take so much, the medicines are addictive, the medicines can, or patients feel sedated. So it requires a partnership and patient education, as Dr. Nair has pointed out. So what we have is to persist taking the medication for a desired length of time, 1 to 1.5 years. Studies have shown that that's a minimum period required, otherwise there are relapses, and the compliance with the medical direction. Now, and this means it actually becomes a responsibility of the treating psychiatrist or the physician, if it's in the primary care, a physician, who must make this therapeutic alliance with the patient, explain the course of treatment, explain the nature of the illness, explain what is expected in terms of outcome, also explain the side effects. Because there's nothing like which doesn't have a side effect. It is rightly said, something which does not have a side effect has no effect. So there would be some side effects. Patients may feel drowsy, they may have dryness of mouth, they may feel constipated, so on and so forth. So, and this has to be a conjoint decision making. And sometimes the factors that cause poor adherence are lack of shared decision making, or insufficient instructions, patient education. You can have a written education if you're short of time. You can have somebody else explain the medication course, or there may be a poor follow-up care. Having a follow-up plan in place helps. And obviously, sometimes it's if it's not a psychiatrist, physician, inadequate dosage, so there's no poor response. Patient doesn't feel the response, doesn't feel well. And if the patient comes up with side effects, being wary and actually handling the, bringing about a change in the treatment. So what is also important is the first consultation. The key is the first consultation. Like I said, that, pardon me, I'm not making trivial of a very important, relationship between the patient and the doctor. Like I said, in anything which you sell, if you're selling treatment, the first impression makes a difference. So what becomes important here is, in the first consultation, a good explanation of the illness, a good explanation of the treatment, the course of treatment, the dosage scheduling, what is expected from the treatment. And their psychotherapeutic work helps. And each one of our patients, definitely, almost everybody asks, so what can I do? Or helping the patient understand what they can do. So self-help strategies. So a good plan would be medication, psychotherapy, so the pills, all the other things, and then of course self-help. And that's where the digital therapeutics come in. So you have these apps which are available for mindfulness. You have these trackers, most of us wear health trackers at times, but you have these apps which are downloadable, which can help you learn mindfulness, meditation, relaxation techniques, apps to monitor your heart rate, to monitor, there are apps to even monitor your, brain waves. So how relaxed and calm you are. And then of course, music, listening to the choice of your music, music of choice, and then the music that can pep one up, not necessarily looking at music that brings one down. And there are music apps too, to calm, to relax anxiety and depression. There are apps which, now you talk in terms of theta wave music, which bring about relaxation. So there are so many other things that can be done, and digital therapeutics coming. Even for compliance, I was working with a team, they were from MIT in the US, and they were developing a technology that every time a patient, obviously it could only monitor till the patient actually pops the strip for a tablet. And a device, an RIFD device or a strip linked to the tablet would send a message through the phone to the doctor or the caregiver that the tablet has been removed from the strip. Of course, it doesn't monitor whether the tablet has been swallowed. So there could be apps to monitor, or apps on which patients can report mood charting, so on. I think a lot is being done, a lot can be done. And all this can promote adherence. And digital technology, especially the fact that psychiatrists are few, psychotherapists are few, we must leverage technology to increase our impact. That's where we are. When IT can make information technology make a difference, here digital technology can actually help in therapeutics. Well, you have also diagnostic technology happening in psychiatry. You have digital technology for diagnostic aiding. They can throw up a diagnosis which is almost 98% ICD compliant, or there is a correlation. So a huge arena in front of us. Artificial intelligence. I was advising a group who were developing a chat bot, looking, you chat and they can track whether you have facial expressions bring up depression. And we refer to something being developed by the Veterans Administration. This is in the US, where this lady, she's a chat bot, graphic. She talks, and almost 200 factors, nonverbal cues are fed in the AI to help arrive at what she's going to respond with. So it's a chat bot. So technology is happening. It's going to happen. And the role of psychiatrists is going to change, and our patient and doctor relationship is going to change. But I think it will change for the better, and adherence will be better. And yes, music makes a difference. I know once, like all waiting rooms, our waiting room has music playing, and patients walk in and they sit down, and then they say, the waiting, even if it's a long waiting, because music helps them relax. It helps them to connect with themselves. They come out from their, rushed crowd, rushed Delhi traffic, and they can sit, relax while they wait for the doctor. If it can have an impact, then it can have an impact in the therapeutics as well. Over to you.
Yeah, thank you, sir. Very well said, sir. So as adherence to antidepressants is one of the major unmet needs in major depression treatment, being associated with negative outcomes, what role does digital therapeutics have as a support tool in improving treatment outcome? Let's understand this further in detail. So I would now like to request Dr. D'Souza to share key insights on digital therapeutics and current need to support treatment in detail. Over to you, sir, Dr. D'Souza.
Okay, now when we look at digitalization, I think what it has done, there is a lot of mobile apps which have helped a patient remember a lot of things. So for example, a very simple thing like a mood graph, where a patient plots his mood over a month, and he comes to you at the end of a month. Very often he remembers the last few days when he comes to meet the doctor. He doesn't remember the entire month. So he's able to look at his mood app and tell you that in this month I've had so many days which were good, so many days which were bad, and I've slept. And you even have an app that tracks your sleep and the number of hours of sleep, and you can correlate that with your mood and tell your doctor. So that's one. You also have apps that remind you to take your pills. You also have apps that allow you to engage with chatbots, which are of course artificial intelligence based apps, and they even administer some kind of therapy to you. Now these are all very useful helpful substitutes in the absence of a psychiatrist, because it can very often happen that you want to call up your psychiatrist, but he's busy seeing another patient and he may not be able to respond to you immediately. So considering that, this is a very, very important platform that we have. We also have apps that warn you that you have to exercise regularly. We have apps that tell you to go, it's your yoga time now, it's your music time now, so you can plan your schedule as per the app. It's also very important that yes, we shouldn't totally become a slave of these apps and let these apps dominate us, and we shouldn't end up whole time being into our smartphone. There's no two ways about that. But what's also important is, I think, there's a lot of information online also which is available. And I think one of the things which I tell a lot of my patients is, don't trust everything that you see online. The validity of the source is very important. And there are a lot of people who might post things which might not be totally true online. So that's another thing that one has to be very careful about. And there are apps like Moodify, Headspace, multiple apps which are available, which play a role. I mean, some are free, some are paid. It's totally your choice. There are apps for online counseling. There are online CBT module apps. So there are multiple apps which are totally available for use. And I think a patient can choose the app, see how he likes it. He can always get off the app. He can choose another app. So there are multiple of these apps available. In fact, I believe that we should ideally scrutinize some of these apps and then suggest them to our patients, because they play a very good role.
So thank you, Dr. D'Souza. So Dr. Mittal and Dr. Arun, what has been your experience with the prescription of or advice of these digital therapeutics along with the routine drug treatment? Maybe in brief, if you can share your experience. Yeah, Dr. Sunil, you will have to unmute yourself.
Am I audible? So Arun, would you like to speak first, or should I? Please.
Sir, you can speak, sir. I'll follow.
Okay. I think, personal experience is certainly there. Today we are in the digital world. Even when it was the analog world, I remember way back in the 1990s, my psychologist had gone to a professional studio to record certain relaxation and certain meditation sessions. And she would hand out at that time cassettes, tapes, so that patients could use them at home. And then when it became digital, and you hand out, on flash keys. So you put them on your personalized instruction for that particular patient and sessions. And then there was an app which we were using some time ago, which was for treating phobias, which was like a virtual reality sort of app for treating phobic disorders. And that's what we were using. And then, of course, there was a time we have been using biofeedback, neurofeedback. And then now today, all that's available on your wristbands. You have the Terra Blue from Bangalore, which has got some biofeedback sensors, and it can give you your heart rate, it looks at your GSR, the galvanic skin response, and so many other factors. And there is good validation. Evidence is there. And then, yes. So I wouldn't promote a particular app so far. People will come and say, may I use some apps? Yes, please go. These are the sort of apps. See what suits you. These 5, 7, 10 apps, what suits you. For mood graph, mood charting, definitely. For keeping track of pills, definitely. For relaxation, for meditation, for mindfulness, for sleep. For promoting sleep, you put on music. I mean, I personally put on music for sleep. And the first thing in the morning I get up is I put on music for the first 15, 20 minutes or half an hour. Helps me plan for the day, helps me relax, helps me, prepare in a more relaxed and calm manner. So I can transfer that experience to my patients and tell them, please try this. And when they are tense, to listen to their favorite music. And then, of course, there are apps which measure your GSR even on, which can come onto your phone. Very primitive, not the advanced apps where, but the very, very small ones. So I do definitely use them in my practice. They are useful, they are helpful, and they work. They are not a substitute for pills, like Gautam said in the beginning. They're not a substitute for psychotherapy. In time to come, carry out CBT and other, more generic psychotherapies, but highly personalized therapies so far still remain the domain of human beings with a good patient-therapist alliance. That rapport, that connect, and that becomes important. So having said this, the digital therapeutics are here. We must use them because they help us create a better impact. And they work like, if I have two hands, they work like another two hands. So had to help understand. It's easy to guide patients, look up certain websites, which is again digital, to look at side effects and so on. So Arun, would you like to add your experience?
I'll mention a couple of statements very briefly. I do recommend apps for people with sleep-related issues and also this digital addiction to some of these adolescents who are addicted to digital things. I do recommend. And also, I do recommend a couple of apps for mindfulness and some relaxation. Most often, it is a personalized kind of interaction, which is best. But in certain situations, when the person is very tech savvy and is very at a distant place, I do recommend some apps sometimes. Thank you.
So thank you, sir. So yes, as of today, pharmacotherapy and psychotherapy remains the mainstay treatment, but there is a role of digital therapeutics. Now let's look at the aspect of psychotherapy. We know that psychotherapy has a positive impact on quality of life, especially its mental health component, and psychotherapy forms that allow non-verbal expression, such as art and music therapies, as our experts have already explained about it. It may offer a potential alternative. Empathy, kindness delivered through the music therapy is an intervention sometimes used to promote emotional health, help patients cope up with stress, and boost psychological well-being. So Shaan, since you are the music expert, could you tell us how music as a tool can improve mood in depression and anxiety? And also, we would like to know about the objective and thought process in recreating your new song, Tanha Dil version 2.0.
Thank you so much. On the outset, I really want to thank all the doctors for sharing their insights, their knowledge, and their wisdom. And, honestly, when I thought of making this song, I had honestly no clue what I'm getting into. I had a very personal encounter with mental health, with clinical depression, when my wife was diagnosed with this 3 years ago. And I'm very glad to share that she's come through stronger and better than ever. And she went through this also with a very brave stand. And so coming back to the question, definitely while I was listening to our doctors, I learned a lot more than probably I came into this evening with. But what I do believe is that even music, be it whether it's a lyric or it's a tune, whether it's a sonic sound of the song you're listening to, the frequencies that are going through your system can definitely create a positive or a negative impact on your system. And I do, personally also feel that if I'm listening to a certain kind of music, sometimes, you try to experiment and you want to, understand different genres of music, but certain genres of music, which could be quite, aggressive in its approach, can get me stressed, can get me feeling a little uneasy. Certain kind of music that we all know that music has its influence on our mind. And another little insight that I've noticed of late is that, now that these numbers have been mentioned, I didn't know that it is literally a pandemic with the kind of people that are being affected by mental health conditions. So disorders, as Dr. Shaan also said, ailments, that I also tend to now understand why a lot of people are enjoying the genre of sad music. At the time, even till about 10, 12 years ago, you could hardly count, be it Bollywood or non-film, you could hardly count the number of sad songs. People were all into this happy, maybe a little frivolous, but still on the happy side. But in the last 6 or 7 years, and especially in the last 2 or 3 years, number of sad songs that are appealing to more people, youngsters who are not even mature enough to understand what is life and why they are being attracted to sad music, with lyrics that talk about breakups, or loneliness, or about one-sided love, or about someone ditching you when they haven't even probably been in a relationship themselves. But somewhere I find that certain they are getting attracted to sad music is because they're enjoying this, and this could actually have a very adverse effect. It's actually pushing their spiral to some extent, that they already want to feel sad. So it's a little scary. And I been like I mentioned, ever since my wife went through this, and there were a lot of reasons that I felt very guilty that I didn't understand this until it happened so much closer to home. A very, very popular actress was very brave to come out and talk about it publicly, and that created a lot of public awareness. And but sadly, even for educated individuals like myself, who likes to keep yourself abreast with whatever is going on, I still didn't understand that how can someone as successful, as young, as who's got so much in such a short time feel depressed. And it's only when it happened closer to home that I realized that yes, this can happen. So as music, I'm sure we may not, through music to find cure might be a little far stretch, but prevention through listening to the right kind of music, the positive music in terms of its lyric as well as its tune, its composition, soothing music that does not stress you too much, that doesn't add anxiety to your subconscious mind, can definitely work as therapy, and can definitely, even if it's not a planned thing. No one wants to listen to music. Music is entertainment, or a comfort zone to go to. But we must choose our music very carefully, and we must choose music that is sonically appealing, aesthetically beautiful, so that it puts you in a good place. It doesn't put you in a place that can add stress to you. And so on my part, whenever I've made music, I try to keep my lyrics as positive as possible. I sing with a smile, so that smile can engage more people in a more positive way. And now coming to the song that I have created, Tanha Dil, just want to talk about it. That very often I have every third or fourth song that I create, I try to make sure that it has a social awareness implication. And the previous song I made was about taking care of your elders, and I've made songs on one-time use plastic ban, air pollution, on all global warming. Even Bhulja, a song that I'd written 21 years ago, was dealing with someone trying to get over depression through heartbreak. So coming back to this song, I wanted to make it hard-hitting. I wanted to make a first-person narrative into what really is going on in the mind of a person who is depressed, maybe medically or clinically depressed. And since I faced this through the person that that the person that is most important to me in my life, my wife, was absolutely adorable. And what through her low phase, I realized the struggle and the fight. And then so I'll just sing the song. We are all doctors here, so I'm sure you don't want any kind of real advice from a complete novice. But I hope that I got it right. So I'll sing the song, and it's self-explanatory, hopefully. So
Thanks. Yeah, thanks, Shaan, for sharing your experience. And we have also understood from our experts, Dr. Mittal, Dr. D'Souza, and Dr. Nair, how the music can act as an adjunctive healing therapy in patients with depression, along with the routine treatment. So I think we have now reached the most exciting part.
One line I want to add. One line.
Yeah, please, sir. Yeah, please, sir.
It is not adjunctive therapy. It also keep your mental health very good. Those who are listening music, it is vital. The mental health is the most important part. Illness is only 4% of it. So keeping mental health in a healthy way, music is a really good.
Absolutely, totally agree with you, sir. So with this, we have been waiting for long the premiere of the song Tanha Dil. So let's play the song,
please.
यूं ही बेवजह क्यों उदास हूँ, जाने कैसी ये प्यास है। कोई पूछ ले क्या जवाब दूँ, आखिर ये क्या एहसास है साथ मेरे सारे वो अपने, अपनों में मेरे बस मैं शामिल नहीं। राहें खुली हैं, है कारवां भी, चल तो रहा हूँ मैं बेमंजिल कहीं। तन्हा दिल तन्हा सफर ढूंढे मुझे फिर ये नजर। तन्हा दिल तन्हा सफर ढूंढे मुझे फिर ये नजर। तन्हा दिल खुशियों से रिश्ता, रिश्तों के वास्ते मुझको फिर होगा जोड़ना। इस दर्द को सीने में लेकर कब तक चलूं, इस दर्द को पीछे छोड़ना। शर्मिंदगी के पर्दे गिरा के मांगो सहारा, राहें खुल जाएंगी। कर लो यकीन जो अब जिंदगी में जीने की फिर से वजह मिल जाएगी। तन्हा दिल तन्हा सफर ढूंढे मुझे फिर ये नजर। तन्हा दिल तन्हा सफर ढूंढे मुझे फिर ये नजर। तन्हा
Wonderful. So Shaan, I would request you to please sing once again,
Sure.
just a couple of lines, please, for us.
Sure. I've written and composed this song myself, and I just want to also thank Salim Merchant from Salim Suleiman, who designed the music for me, and Iqbal Rizvi, who created the video for me. Iqbal Rizvi himself has been speaking in seminars about mental health. So, this topic was very close to him. So I think, he did a great job in keeping those visuals so connected to the lyric. So,
यूं ही बेवजह क्यों उदास हूँ, जाने कैसी ये प्यास है। कोई पूछ ले क्या जवाब दूँ, आखिर ये क्या एहसास है साथ मेरे सारे वो अपने, अपनों में मेरे बस मैं शामिल नहीं। राहें खुली है कारवां भी, चल तो रहा हूँ मैं बेमंजिल कहीं। तन्हा दिल तन्हा सफर ढूंढे मुझे फिर ये नजर। तन्हा दिल तन्हा सफर ढूंढे मुझे फिर ये नजर। तन्हा दिल।
Thank you so much, Shaan. So we have got a wonderful response from all our audience. We have received hundreds of messages and there are so many questions. They want to connect with you. So Shaan, one of doctors from Lucknow, he's asking that why a song for mental health as a priority. And another doctor from Jaipur is asking, Tanha Dil is one of your best songs and has given you the identity. Do you feel that this version second of this song will match the aura of your previous song?
I know why mental health is because, like I explained, that this song is something that I've personally experienced through my wife, and I felt that after that I got talking to so many people, friends, families, and I got to know that it is rampant. Like our doctors are saying, it's a pandemic that is only thanks to the 2 years of COVID. I got a report from Gravitas, I think, where they mentioned that we've lost more people to suicide in India than to COVID. So somewhere a lot of that has to do with our mental makeup and our mental health situation. So it is something that needs to be addressed, and not just by the medical fraternity, not just by doctors, but even if all of us can come out there and tell people, because when a doctor is talking about it, people do get a little skeptical. They start thinking, oh, the doctor, so maybe this is something to do with the medicines that they want to push onto us or something like that. Even I have been victim to this kind of skepticism. But when people do it, people say it who've gone through this, and today I can tell anyone and everyone that the whatever medicines that my wife had to deal with has actually helped much more. And the side effects, yes, like doctor mentioned, maybe nausea, maybe certain other little things, but that's nothing to compare to getting her life back. So if that can help you get your life back, I don't see why one. And of course, she's been out of most of her medicines, so which is great too. And so yes, that was the reason that I wanted to do a song on mental health. I couldn't find a better phrase to actually, उसको जो ज़हन में जो चल रहा है, तन्हा दिल तन्हा सफर, ये ऑफ कोर्स मैंने खुद ही इस गाने को लिखा था आज से 21 साल पहले, जब वो एक यंगस्टर की जिंदगी का एक ऐसा वक्त आता है कि जब आपको डिसीजन लेना होता है कि शायद अब्रॉड जाएं या अपने गांव छोड़कर शहर जाए, जहां आपको रोजी रोटी बेटर मिल सकती है, लाइफस्टाइल बेटर मिल सकती है, लेकिन शायद कहीं ना कहीं वो लाइफ आपकी थोड़ी बहुत वहां खो सी जाती है। तो उस पर मैंने वो गाना बनाया था। एंड इट्स लाइक अ फुल सर्कल नाउ दैट आई स्टिल कांट गेट अ बेटर फ्रेज जब मुझे ये बात कहनी होती है कि जब आप खुद को खो देते हो, जब आप खुद को ही आप खो नहीं पा आप पा नहीं पा रहे हो, तो ये जो सफर है ये तो एक तन्हा सा सफर है, क्योंकि यू आर योर ग्रेटेस्ट कंपेनियन। इफ यू कांट फाइंड योरसेल्फ, तो ये सफर तन्हा, ये सफर ये दिल तन्हा है। और ढूंढे मुझे फिर ये नजर, अब मैं खुद को ढूंढ रहा हूँ, वो मैं जो सही था, जो ठीक था, वो कहाँ चले गया? Where is that person gone? I can't find him, and I'm looking for him. And that is how I thought of this song. Of course, Tanha Dil is an iconic song, and obviously my identity song, the one that I wrote. आँखों में सपने लिए घर से हम चल तो दिए। तो मैं कभी उस गाने को रिक्रिएट करने का मुझे कभी ही ना शौक था, ना हिम्मत थी, ना जुर्रत थी, ना ही मैं कभी किसी गाने को रिक्रिएट करना चाहता हूँ। मुझे लगता है कि जो गाना एक बार बन जाता है, वो मुकम्मल अपनी जगह सही गाना बन जाता है, उसको फिर से रिक्रिएट करने की कोई मतलब नहीं। हाँ, आप रीमिक्स थोड़े नए बीट्स डाल के साथ वो उस चीज को कर रहे हैं तो अलग बात है कि चलो जो नई जनरेशन है वो उनको एक नया साउंड मिले। लेकिन ये गाना मैंने सिर्फ वो फ्रेज यूज किया है, गाना पूरा ओरिजिनल आप तो अभी सुना भी। इट हैज नथिंग टू डू विद तन्हा दिल तन्हा सफर, दो दैट फ्रेज मैचेस, बट इसका ट्यून अलग है, स्केल अलग है, टेम्पो अलग है, और तो मैंने बस वो फ्रेज का सहारा लिया क्योंकि उससे बेहतर फ्रेज मुझे नहीं मिल रहा।
Thanks, Shaan. So we have some questions from our audience, viewers. Dr. Sunil and Dr. Arun, our viewers wants to know that what kind of music would you recommend to your patients of depression and anxiety as a psychiatrist here?
Okay, there has been a lot of research regarding the impact of music therapy on the mind state of people with chronic medical illnesses. There was this article which was published in 2015 in World Journal of Psychiatry, which was an analysis of 25 trials which were conducted in different parts of the world on chronic neurological disorders, 11 studies on dementia, 9 on stroke, and 5 on Parkinsonism, multiple sclerosis, and other neurological conditions. And all these studies very clearly demonstrated that music therapy had a positive effect on the mood state, anxiety, and quality of life of people with chronic neurological disorders. Similar studies have come from different parts of the world in diabetes also. And I myself had a personal experience regarding music because last year, following the first wave of pandemic, I was taking COVID duty wearing PPE kit for 8 hours continuously. There was a shortage of PPE kit in our place, and I had to wear it for 8 hours continuously without even drinking a glass of water. And after 2 weeks of COVID duty, I found that I could not eat or drink anything. And it was a very terrible state. And I did an endoscopy done, and I found out that there was extensive ulcers in my stomach. It was the most difficult phase of my life. For 3 months, I was out of activity. I could not speak because the acid was surging up. I could not eat anything. My weight reduced by 15 kilograms. I could not go to work. I could not even write a book. Well, if I was healthy enough to do that, I would have done that. I was sitting alone doing nothing. What could I have done to overcome that kind of tanhai, which was very, obvious at that point of time? I switched to music. I started listening to a lot of music. Actually, Shaan's Tanha Dil first version came when I was a medical college student. And that was a song which used to grow upon us. It is not a song which just attracts you in the first listen and you keep it away and run after other songs. Every time you used to listen to that song, that used to grow upon you. The music, the expressions he gave, and the lyrics even. I used to listen to that song for almost 2 years continuously during that phase of life. And then when one becomes busy, most of these things take a backseat. And probably after a long time, I listened to Tanha Dil last year. Due to some strange reason, I was going through those songs which I loved. And one of my favorite singers, S.P. Balasubramaniam, had died at that point of time. I spent a lot of time listening to his Telugu and Kannada songs. And that helped me a lot. And again, one thing which Mr. Shaan had very clearly illustrated, I just switched to certain fast music, some rock music, and I could feel the acid surging in my stomach. And I had to switch off that music within a couple of minutes and go to very soothing music. So I prescribe music especially to 3 categories of people. Number 1, elderly people who are suffering from empty nest. The children have migrated to distant places, they are feeling alone. And any kind of soothing, I just have a chat with them regarding the taste of music which they have. So some people may enjoy classical music, some people may enjoy light music, some others Western music. And depending upon their personal preferences, I do give some suggestions regarding music. And after listening music for at least 15 minutes a night, the quality of sleep improved significantly for the elderly people. In those people with mild cognitive impairment also, music seems to have produced some wonderful results. Another group of people is these youngsters, adolescents who are going for competitive examinations, the medical entrance examinations, and even the civil service. I'm mentoring quite a lot of people who are into civil service preparation. I advocate music to them. Again, the music of their choice. Some soothing music with excellent instrumentation, I do suggest to them. And most of them have come back to me saying that this has helped them a lot. So I feel that we need to conduct randomized controlled trials about the efficacy of music, different types of music on different illness conditions. And that is, I think, the way forward, and that can come forward with very concrete research evidence regarding which music is good for which condition. Thank you.
Sure. Dr. Mittal, please unmute yourself.
So Dr. Arun has mentioned that very well, so there are a lot of research data. So I think like what Shaan said is sonic music. So music can charge us up and like a rock is of protest, so you have music which calms you down, which helps you relax. It brings down your heart rate, it brings down your breathing, it brings down the metabolic states, it alters the brain waves. So music which may be specific. So for people from different subcultural groups, it could be specific music for them. Something which they know helps them relax. It can help improve sleep if listened to before. Swami Ram used to say this, and so that's where I picked this up from. Listen to your favorite music 15 minutes before sleeping, 15 minutes after getting up. It helps you. It helps you, rejuvenate. Einstein said this, that he lived his life in music. He lived his fantasy and daydreams in music, and he couldn't imagine life without music. And he said that if he wasn't a scientist, he would have been a musician. So music enhances cognition. There is enough research and data available. The musical abilities, the notations, they all enhance your abilities to think abstract, to do things which are abstract, improving cognition. For some years I learned the Indian classical, the violin, and so was introduced to the ragas. And then you realize that how
next
powerful that can.
program, sir, we'll listen.
What powerful change it can bring on you. It's raining, you want to listen to Malhar, you want to listen to Rag Basant. Early morning, you want to listen to some other music, and it sort of revives you, it rejuvenates you. It puts you in connect and harmony with that nature. So this is the Indian system. I'm sure all across the world, it's the same. Music is a language which doesn't require verbs. You look at children who are 1 year old, 2 years old. I've seen children, they would experiment with sounds. They would listen to different sounds. I recall my son expanding a rubber band, listening to it, playing on a comb, listening to it. So listening to music, and children enjoy it. And you can see, you play loud music, you play music that disrupts, children start crying. They feel disrupted. So it's the same. So happy music, melodious, lyrics. So beyond the music, the lyrics, they impact us, they help us. And like now listening to Tanha Dil, 2.0, one can connect to this, that break the barriers, speak up.
Giving the hope.
Yeah. And so music can inspire that. So I think it's true. And there are studies, like I refer to the Cochrane database study, which said that it adds on to the recovery from depression. There is music therapy. Well, not here, but in the US, you have the Association of Musical Therapists. And I think I was doing some work with the DST, Department of Science and Technology. We're doing some research in cognitive science. And there was this proposal from Nimhans, they were doing in music therapy. So the effect of music.
Sir, I am also agree with you. Music is a very powerful tool. In India, we know from the Tansen.
Yes.
It makes raining. Megmallar is one of the things which is used to play during this time. I mean, for the raining. And it is not that the music, and sometimes I feel lyrics is important, definitely. But sometimes only tunes is very important.
Yeah, the sonic connection. That
Sonic connection. In other languages, there are lots of favorite songs are there. We used to listen because we like that tune.
That tune. I just want to add one more thing about music that I have realized. Like, people will talk about Tanha Dil. It's not just the song or the lyrics. It's also where it takes you. So sometimes when music will take you to a happy place in your life, growing up, or, you have some good memories connected to those songs, automatically, when you're feeling down, you listen to that song that takes you to that, happy place, you automatically start feeling better. Like, I love to listen to the songs of 70s, 80s. I love to, every time I hear Kishore Kumar's voice, or I hear Mohammad Rafi's voice, I hear Lataji's voice, it just makes me feel thrilled. So,
Mr. Shaan, it has got therapeutic value. I am explaining why. Because there is a word is called catharsis. That means something in your mind. We have 3 parts: conscious, unconscious, and preconscious. I mean, between unconscious and consciousness, there is a preconscious state. But there are lots of things present in our unconscious mind. Maybe they are the root cause of our mental issues. Right. Sometimes after listening all this music or the other art therapy, they will come up. True. They'll come up in the conscious level. That is a therapeutic value. That is most important.
I also, Dr. Sir, I want to say that when my wife was going through this thing, and then, obviously, her therapist must have suggested music. and she would play Ek Onkar, you know, the Shabad, the very famous Shabad Ek Onkar, and she would play the Hanuman Chalisa. And initially I was like, you know, while she's playing it, I can't just get up and walk away. So I would just patiently wait till it's over. But I always, after a point when, you know, if I'm somewhere out, I'm not there, I miss it. I said, no, I want to play that just even though I'm not going through anything, but it just calms you, makes you feel so much better. So like you said, that even if it's not, someone is not going through the situation, but in general, if you wake up with a song that calms you, feel so much better and generally in life. So when you were saying that, I realized that, you know, when her playing Ek Onkar or the Buddhist chant, it just made me feel so much better too.
Absolutely. So thank you so much. Now I would like to request Dr. Gautam Saha to give concluding remarks and close the session.
I don't know what to say. Again, Mr. Shaan, be with us. And thank you, Lupin, for organizing such an excellent program. In fact, I always believe that the art therapy has a role of the adjunct therapy. Like, it is not only music therapy, it is also dance therapy. Even animal therapy is done in the autistic child right now. So there are lots of scope. We have to investigate much more. Yes, definitely, as a biological therapy is the first line of treatment, but adjunct treatment, they are helping a lot. Maybe in mild to moderate cases, they have a major role. We have to investigate, we have to research on it. And thank you, Mr. Shaan, for being with us. You know that Rabindra Sangeet is our life.
Of course.
আপনি তো জানেন নিশ্চয়ই।
নিশ্চয়ই অনেক রবীন্দ্র সঙ্গীত করেছি, and it has actually worked wonders for me also.
Rabindra Sangeet, it is the life of us, actually.
True, yeah.
What not there, everything is included
True.
there. So thank you so much, Mr. Shaan, again, and Lupin for organizing. Yes, today, yes to life is established. Yes to Lupin. Thank you.
Thank you so much. Thanks.
I would
Thanks
also
a lot,
love to
Shaan.
thank Dr. Nair, Dr. Mittal, Dr. Saha, of course, and Dr. D'Souza. You know, I've learned so much from all that they've spoken about, and such strong insights that I'm so glad that I was a part of this evening. And thank you, sir, for hosting us. Thank you, Lupin. And may the sunflower always, always bring more hope and more life to our lives.
Thanks, Dr. Gautam, Dr. Arun, Dr. Sunil, and Shaan.
For adding music to our lives.
Thank you.
So I think we can go offline.
Do all the best in the future, Mr. Shaan.
Thank you.
We want to listen much more from you.
Thank you so much. Also, if Civil Saab is there, Rajivji, thank you so much for organizing this and making me a part of it. And hopefully, whenever Thiruvananthapuram mutta aanam nahi hota hai, but Kolkata to aasche thaki. So whenever I do, Doc, I'll surely catch up and we'll meet up.
Thank you so much. I'll meet.
Yes. And of course, Dr. Mittal, Delhi, I'll be there.
Yes, looking forward.
Definitely. Lovely. Thank you. And Dr. D'Souza to हमारे घर के ही हैं, so we can always catch up. Wonderful. Okay.
Thank you.
Bye.